Reporting live from Channel 28 News, where Ebola, a deadly virus, is now a concern in the Bahamas. Ministry of Health are monitoring this virus as it is spreading. Dr. Josie, a microbiologist, is here live with us this morning. Dr. Josie, what can you tell us about the Ebola virus?
The Ebola virus sickness is a fatal disease that primarily affects the African continent. In 1976, near the Ebola River in what is now known as the Democratic Republic of Congo, the Ebola virus was found for the first time. Since then, the virus has infected people on a regular basis, causing outbreaks in a number of African countries. We do not know as yet where the virus came from. The virus is transmitted to humans through direct contact with animal blood, body fluids, and tissues. The Ebola virus then transmits to others by direct contact with the body fluids of someone who is sick or has died from Ebola virus.
Do you believe that there will be a possible cure or a vaccine for this deadly virus?
As of right now, there is no cure for the vaccine for Ebola. However, my team and I are working and researching tirelessly to at least reduce the cases of this very deadly virus. We are using the drugs imazib, that is a mixture of 3 monoclonal antibodies. It can be used in adult and pediatric patients given via injection. This drug targets the glycoproteins that is on the surface of the virus. We are also using the drug Ebola, that is a human monoclonal antibody that is also given via injection. This drug is also used for pediatrics and adult patients.
Thank you, Dr. Josie, for the information. Also joining us live today is Nurse Mackey down at the Princess Margaret Hospital in Nassau, Bahamas. Nurse Mackey, what can you tell us about what you're experiencing at the hospital?
Good morning. My name is Daniqua Mackey. I am a registered nurse at the Princess Margaret Hospital. I am also a part of the Ebola ICU unit. First off, there's been an increase in the Bahamas from Ebola patients. However, my team and I have been working very hard to contain Ebola patients. Furthermore, Ebola patients have been suffering from fever, chills, chest pains, cough, abdominal pains, diarrhea, nausea and vomiting, weaknesses, joint and muscle aches, and lots more.
Can you tell us ways in which the public can continue to stay safe?
Ways in which the public can continue to stay safe is by sanitizing contaminated areas, wearing their face masks, staying away from crowded areas, and following the Ebola protocols.
Thank you, Nurse Mackey, for that insight. We also have with us Dr. Falusi, a doctor in South Africa. Many believe this is where the virus originated from. Dr. Falusi, what can you tell us? How are things in Africa?
Good day from South Africa. I can say right now that we are not prepared. We weren't prepared for this. Our healthcare system was not prepared for this at all. So right now we are focusing on getting funds from the government, soliciting grants from nonprofit organizations, and appealing to the WHO to receive funding for our medical facilities, because there's a lot that we need to get right now, ranging from oxygen masks, beds, we need towels, bed sheets, oxygen masks, catheters for some. We also need extra PPEs. We also need safe electricity, which has been an issue. So we've now had to go on and appeal to fuel companies to give us food at a reduced price that we can pay off at a later time. But besides that, I can't say that has been manageable because, as you know, we're overwhelmed. We're not prepared, but we are making progress. Currently, right now, we have about 5,000 patients spread across about 10 hospitals. So you can understand how overwhelmed we are, and with such sparse resources, there's so little that we can do. But in the face of all that, we are trying our best. We are sensitizing our communities, telling them what to do, telling them the identifying factors of those who may have Ebola or those that they may suspect to have Ebola. We are guiding them as to not to ostracize them, but to report them to us so that we can be able to go in, bring them in, and treat them and isolate them. While we are here right now, and we are going to deal with isolated patients, as you know, we use our PPEs to sit down. In certain cases, we also do use hazmat suits for more superstitious of our staff. They decide to use PPE and hazmat suits, and we make sure that we have already corralled off a little area inside the isolation room that is continuously disinfected. Every time someone walks in or walks through it, it's always disinfected. So this is where we discard and incinerate our PPEs, and for the more superstitious staff, their hazmat suits. But besides all of this, we are making steady progress because of our community-wide sensitization and because of it being such a large thing in the media and on the news, and it's reaching a lot of people. The cases have steadily been decreasing as people are constantly reporting to us those who may or may not have Ebola, who they suspect might have Ebola, and we are taking care of those areas and what needs to be done. Thank you.
Thank you, Dr. Calusi. Good luck and stay safe. Thank you, everyone. This is Natalia Thompson coming live from Channel 28 News. Just a reminder, wear your mask, stay safe, and social distance. Thank you for watching.